नमस्कार वंस अगेन वेलकम टू अनदर इंस्टाग्राम लाइव। और आज एक और नए स्पीकर के साथ मैं आया हूँ बात करने के लिए मेंटल हेल्थ एंड फिजिकल वेलनेस के ऊपर। तो आज हमारी जो स्पीकर हैं शी इज़ healing from Mumbai itself. She is a alternative medicine specialist having a multiple modality knowledge. Her name is Pragattee Kanugo. Pragattee is a leading graphologist, a signature reader. She is also well known for the acupressure, acupuncture therapy, as well as she is also into the other modalities like numerology and logo designing also. So I've been inviting to Pragattee to come to this podcast and ये बताएगी कि एक्यूप्रेशर एक्चुअल में क्या है, इसकी ओरिजिन क्या है, यानी उस पर मैं चर्चा करूँगा जहाँ पे मैक्सिमम मैं लोगों को इस विषय पर ज़्यादा से ज़्यादा बता सकूँ. जस्ट होल्ड ऑन, आई विल जस्ट ट्राई टू इनवाइट प्रगति. सो जस्ट होल्ड ऑन. Pragattee will be there. So, Namaskar Pratima ji. So, today the session is more on the acupressure. Acupressure का जितना मुझे knowledge है, acu means the pointed and yeah, I think she is there. Pragattee, just make the selfie mode on.
Yeah,
आपका
just
rear camera. Yeah.
am I audible?
Yeah, now it is visible.
Okay.
So,
Am I audible?
good. Yes, you are audible. Clear, एकदम clear है. ठीक है. So, welcome Pragattee to the live podcast show, the Sunday podcast show, and there are many people are slowly and steadily joining. Pahuja 1989, she also joined. Hi Pahuja ji. So, I was talking about you are giving a small glimpse of your introductory that what you are into. What I know, Pragattee, about you that you are into the graphology, signature science, logo designing, and other alternative therapies like what we say, acupressure, acupuncture. Okay, so I think these are the areas. So, what are the other specialties I want to know about you from your own mouth? आप बताइए आप क्या एग्जैक्टली यही करते हैं, इसके अलावा और भी कोई मॉडलिटी इसमें आपकी स्पेशलिटी हो?
Okay, so I have been doing acupressure, sujok, reflexology,
ओके सुजो.
and everything
ओके
which revolves around acupressure is something which is my primary thing, and I wish to take this forward because honestly, for me, it's more like an alternative medicine, a medicine
ओके
which is not exactly like a medicine, but helps and works like a medicine.
okay okay okay. So that's a small introductory lines about the Pragattee Kanugo. So today our topic of discussion will be acupressure. So Pragattee, before we jump into this topic, I want to know how you come down to acupressure as a modality, how you get introduced, और आप उसमें कैसे जुड़े ये
Okay,
modality के साथ, कैसा आप?
since you know that I have been into multiple fields and have been juggling with a lot of different work, my story began when I think my brother was born. So,
Okay.
because he's a Down syndrome child, what used to happen was
Okay.
that we used to visit every other doctor. We used to kind of find what can be done, what can be actually be helped, and that's how we just came across. So we tried basically everything that can be naturopathy, acupressure, every modality, including
Okay.
medical sciences. But when
Okay.
I came across acupressure, my mother had first learned just to see how it works and how it could actually help. So that was a turning point for me because I used to be like, हर चीज के लिए दवा है मुंबई में, मतलब इंडिया में, तो बस ये पॉइंट्स दबाने से तो क्या ही होगा. So that was my first
Okay.
reaction when my mom told me that ये पॉइंट्स दबाने से ailments ठीक होते हैं. So I was like, कुछ भी मतलब ऐसे थोड़ी ना ठीक हो जाता है. But when I actually saw the
Obviously.
results, जब मैंने देखा कि मेरे भाई के ऊपर भी इसका असर हो रहा है, So that's when I was like, okay, नहीं अभी तो मुझे थोड़ा ज्यादा देखना चाहिए इस साइंस को, डिस्कवर करना चाहिए कि अगर अगर उसके ऊपर भी असर हो रहा है तो शायद हमारे ऊपर भी हो जाएगा. And that's how my journey began.
Okay, great, great. So, Meg, अगर तूने mean from which teacher or institute you learn this modality of acupressure? Just for the
Yes.
audience.
So
Know it.
today I have been so today I have been licensed by Maharashtra government regarding
Okay.
acupuncture. So अभी ये साल ही उन्होंने महाराष्ट्र गवर्नमेंट ने डिसीजन लिया कि वो लोग अपनी मोडालिटीज को ऑल्टरनेटिव
Okay.
मेडिसिन को प्रॉपर मेडिसिन के रूप में एक हिस्सा देंगे. जैसे कि नेचुरोपैथी का एक हिस्सा है, वैसे ही अभी एक्यूपंक्चर का भी एक लाइसेंस प्रैक्टिशनर का सर्टिफिकेट जितने भी प्रैक्टिसिंग एक्यूपंक्चरिस्ट है उन सबको दिया गया है. ओनली फॉर द रीजन बीइंग कि अब तक वी वर नॉट any validation, but the government felt that okay, now that people are actually being healed, we need to give people validation taki it is more like a concrete form. And today around 6,000 acupuncture practitioners are there in Maharashtra, so it's not like it's only very few. 6,000 is a huge number.
Definitely, definitely. So now let's start with the main topic. As you told, now it is certified by the government of Maharashtra, and there are 6,000 practitioners there. So that means they have validated something. उन्होंने कुछ सोच समझ कर ही इसको सर्टिफाई किया होगा, मतलब इसको रिकॉग्निशन दिया है. तो अभी इस साइंस के बारे में मैं मोटा मोटा आपसे जानूंगा कि what is acupressure? If you want to just explain into the 3-4 lines, what is the acupressure?
Okay. So simple language में, if we talk about what acupuncture is, it's basically that all the nerves of our body are somehow very connected to each other. तो जैसे कि जैसे कि we say that okay, if I look at my fan, if I just look at the fan and if I look at the switch of the fan, दोनों बहुत अलग जगह पर होते हैं. The same way it is similar that all and pressing the switch is actually helpful. For a simple example, if somebody has a headache and if I just press the points on the thumb, people will be like, दबाने से head and thumb का कोई connection नहीं है. But indirectly, जब headache होता है तो head का switch thumb के ऊपर है. वो thumb को जैसे ही दबाओगे, you will feel better. So it's basically, it works on two principles. Acupuncture works on two principles. One is that the blood circulation of my body needs to be correct. And second, जो भी मेरे body में जो भी waste इकट्ठा हो रहा है, like stomach is the mother of problems in acupuncture because whenever that we fall sick, it's like all the junk is getting accumulated in my stomach. And to ensure that all the waste is out from my stomach, I need to first clear my gut health. So these two are the main principles which acupuncture functions on. One, the blood circulation needs to be good, and two, whatever ways that your body doesn't require, it can be in the form of acidity, it can be in the form of gastric, it can be in the form of constipation, that needs to be flushed out from your body.
Okay, great. So, Pragattee, the next question comes from it's here also. Okay, what is the meaning of acu and pressure? We understand, मतलब दबाव डालना. What is the acu means in the acupressure? What exactly it means?
Acu का मतलब है needle. Be needle I can give in form of various. Needle in itself has various meanings. जैसे कि needle अगर मैं हाथ से दबाऊं तो हाथ भी मेरा कहीं ना कहीं पे needle हो जाता है. But if I actually have that acupuncture needle, that also acts like a needle. I can have various instruments such as jimmy or whatever. तो वो भी कहीं ना कहीं पे needle के रूप में act करता है.
Okay. तो ये अगर मैं इसके इतिहास के बारे में, if I will know the origin, how from where it originated, how it flourished throughout the world. ठीक है, ये कैसे, इसकी origin क्या है, कहाँ से आया है, कौन सी देश से ये जुड़ा हुआ है, आप थोड़ी इसकी हिस्ट्री के बारे में. I'm not telling you we should go in depth into the history of acupressure, but at least a glimpse of the acupressure history.
So इसका इतिहास गूगल पे मिलता है कि this is 5,000 years old therapy and majorly practiced majorly in China and all these but at the same time, when I look at my Jane Agam, in Jane Agam also I get reference to acupressure. So I don't know how true Google is or how true my Jane Agams are. But one thing is for sure that if it's there in my Jane Agams, that means it is a lot more older therapy than what Google has said it. So because
Okay.
पहले के जमाने में क्या होता था कि पहले के जमाने में वॉर्स काफी होते थे, तो जब वॉर होता था तो अगर उनको सुई इधर लगी, ऑब्जर्व कि मेरा लॉन्ग टर्म का जो स्टमक एक पे वो ठीक हो रहा है, सो दैट्स व्हेन दे पीपल गॉट मोर क्यूरियस टू फाइंड आउट कि अगर सुई इधर लगने से अगर इसका स्टमक ठीक हो रहा है तो कैसे हुआ, एंड दैट्स हाउ द एंटायर रिसर्च, that's how people started exploring it. They did their own research, and that's why for one stomachache they did not find one particular point, they found multiple points. तो जैसे कि सूजो हो गया, रिफ्लेक्सोलॉजी हो गया, सबकी थेरेपीज थोड़ी बहुत अलग है क्योंकि उनको एक ही पॉइंट, उनको बहुत सारे अलग अलग पॉइंट्स मिले कि स्टमक को ठीक कैसे किया जाए, एंड दैट्स द थेरेपीज हैव बीन फ्लरिशिंग सिंस देन.
Okay. Okay. So that means you mean to say that it is again the origin is from India itself. Okay. So what I have
Yes.
read into the few books that acupressure originated, I think, रामायण महाभारत कालम, जहाँ पे जो आपने बताया बिल्कुल सही कहा कि वो जब सोल्जर्स को जब लगता था कहीं पर, चेस्ट पे लगता था, हाथ पे लगता था, their ailments get starting heal, and then all those research started from that war areas. पर अगर क्योंकि आज अगर कोई एक्यूप्रेशर टाइप करता है तो वो उसको चाइनीज में कनेक्ट किया जाता है, तो हाउ दिस एंशिएंट ओरिजिन, इंडियन ओरिजिन modality goes into the China and then it has been known as a Chinese therapy. The reason, any specific?
The reason being that wars पहले ज्यादा कहाँ होते थे, and India would have to fight war with whom? So India was on a long time war with China and other countries, and moreover because China और countries में ज़्यादा practice किया जाता है compared to India, that is why it is said that it's a Chinese therapy. अभी इंडिया में क्या हो रहा है that we have multiple forms of medicine. It can be Ayurvedic, it can be naturopathy, it can be normal medicine. There are multiple forms of medicine. But whereas in China and these countries, people focus on healing themselves more naturally. अभी सरदर्द, फॉर सिंपल एग्जांपल, अगर मुझे सरदर्द हो रहा है, इट्स वेरी इजी टू टेक अ मेडिसिन, बट एट द सेम टाइम आई नो दैट द सेम मेडिसिन विल समहाउ गिव मी साइड इफेक्ट्स इन द लॉन्ग रन. बट चाइना और कंट्रीज में क्या होता है, पीपल आर वेरी पेशेंट, दे फर्स्ट वांट टू गेट देमसेल्व्स हील्ड naturally, then they will opt for any medicine like crocin or something because they know the side effects. So majorly awareness is something which is playing a major role in spreading acupuncture, and moreover the practitioners that they are doing it, it's like it's not a quick medicine, to be very honest. ऐसा नहीं है कि मैंने एक पॉइंट दबाया and आप ठीक हो जाओगे, नहीं. Because it's a very slow and a steady process. People somehow become very impatient, like मुझे आज का आज ठीक करना है. So that is why it is more practiced in these countries. But slowly and steadily people have realized the importance of these medicines, and it is coming back to India. That is why Maharashtra government has given its validation today.
Good. Now another question which coming in my mind कि अगर आप बताइए तो चलो अब पूरे एरिया में स्प्रेड हो रहा है, तो एक्यूप्रेशर की बात करें तो बहुत सारे अलग अलग मॉडलिटीज उसमें पाए, क्या वो उसके प्रकार है? इट इज अ डिफरेंट टाइप ऑफ एक्यूप्रेशर, लाइक सूजो, एज यू टोल्ड, रिफ्लेक्सोलॉजी इज देयर, मेरिडियन एक्यूप्रेशर इज देयर, ठीक है, हैंड एंड फुट एक्यूप्रेशर इज देयर, और पंक्चर में आता है हैंड एंड फुट पंक्चर. सो इट इज द only the branches, or this is a different modality or different type of acupressure? ये जो अलग अलग इसमें प्रकार बताए गए वो
इसमें अलग अलग प्रकार इसलिए बताए गए हैं फॉर अ सिंपल रीजन दैट just to make it easy very much for people. For a simple example, I know that for poking pin, for some people will be like, oh, she's poking a pin. No, मतलब मैं उसको पिन लगानी नहीं दूंगी. But at the same time, if I just press, people will be like, okay, it's just like a massage and everything. So you can press for how long as you want. So modalities
Okay.
बहुत अलग अलग इसलिए है because based on people's convenience. For a simple example, if I
Okay.
give people a high dosage medicine, their body will not accept it in the first go. So I'll have
Okay.
to gradually take them through the process. Like पहले बहुत आसान medicine दो and then take them through the process के okay, now you are comfortable, now you can go for a high dosage medicine. So that's why these
Okay.
different modalities are there. And honestly, hand, foot, ear, acupuncture, all these points, because there are multiple switchboards, everything is beneficial.
ओके ओके अच्छा अगर ये बात की जाए तो क्या जो अलग अलग मॉडलिटीज है चूजो हो गया और मेरिडियन हो गया रिफ्लेक्सोलॉजी है क्या इनके ओरिजिनेटर भी चाइनीज रहे या वो भी अलग अलग रहे इन अलग अलग मॉडलिटीज के
वो भी बहुत अलग अलग रहे हैं because some of them are from India, some of them are from Malaysia, they are from Hong Kong, they are from Chinese. So the authors have in itself been very, very different for a reason being that everybody had a research, everybody wanted to focus on one subject. For a simple example, if I say like how to cook foods, किसी को एक चीज पे फोकस करना था. For a simple example, somebody just wanted to focus on your, तो उन्होंने पूरी डिस्कवरी सिर्फ योर के ऊपर ही की है. किसी को स्कैल्प
ओके
के ऊपर पॉइंट्स देना आसान लगा तो उन्होंने पूरी डिस्कवरी सिर्फ स्कैल्प एक्यूपंक्चर के ऊपर किया है. Somebody wanted
ओके
to just focus on hand because they felt like hand is everything. उन्होंने सिर्फ हैंड के ऊपर डिस्कवरी किया है. सो दैट्स वाई ऑथर्स भी बहुत अलग अलग रहे हैं एंड एवरीबॉडी हैज डन अ ब्रिलियंट वर्क. मतलब ऐसा नहीं है कि एक भी ऑथर ने या एक भी फाउंडर ने कुछ दे हैव पुट देयर हार्ट एंड सोल. उन्होंने काफी अच्छा रिसर्च किया एंड दैट इज वाई द नॉलेज इज अवेलेबल टू अस. So I would honestly be very grateful for them to bring this knowledge to us and to pass it on to further generations.
ओके ग्रेट ग्रेट क्योंकि आपकी एज में कोई इतना नॉलेज एक स्पेसिफिक हेल्थ केयर में इतना घुसता नहीं है बिकॉज वेरी यंग एज बिन goes toward the acupressure. There are so many different acupuncturists I also met in my undergraduation time, but they were all old age and they have the mentality कि भाई हमारी ही modality सही है, acupressure ही सही है, acupressure सही नहीं है, सुजो की सही है, acupuncture सही है. Now there are some contradiction between the two modalities जो कि मैं सबको एक ही मानता हूँ. तो क्या आपके साथ में ये कभी हुआ कि कोई इंसान सुजोग से सीख के आया और फिर आपके पास एक्यूप्रेशर मेरिडियन के फॉर्म में आया और बाद में कुछ कॉन्ट्राडिक्शन स्टेटमेंट दिया था या दे रहे हो, ऐसा कभी हुआ आपके साथ में?
फॉर मी पर्सनली मेरा व्हेन आई गिव ट्रीटमेंट टू माय पेशेंट्स मेरा फोकस इसके ऊपर नहीं रहता है कि मैं कौन सा मोडालिटी में चूज कर रही हूँ. It can be sujok, it is reflexology, it is head, it is ear, it is hand, foot, it is everything. The only reason being that my focus is majorly कि मैं patient को कैसे ठीक करूँ. So even if I combine multiple therapies, even if I choose one therapy, or if I have to combine multiple therapies, what is the harm in it? So for me personally, the motive is always to treat the patient, not through which modality that I choose. That comes secondary. बिकॉज अभी के लिए तो उसको ठीक होना जरूरी है ना. लेटर ऑन इट कैन बी लाइक कि वो कौन से मोडालिटी से ठीक हो रहा है वो इम्पोर्टेंट नहीं है. बट ऑल्टरनेटिव मेडिसिन एंड एक्यूपंक्चर के ब्रांच से ही ठीक हो रहा है, राइट. सो दैट इज समथिंग विच इज वेरी इंपॉर्टेंट फॉर मी. And that is when I combined multiple therapies, I saw that the results were brilliant. Like patients इनको 15-20 session लगते थे, today they are fine in like 5 sessions. So how did this happen? Is because understanding different authors, what worked for them, what did not work for them, and for me it's like a boon कि उन्होंने सब लिख दिया है कि क्या experiences उनके रहे हैं, and it's just readily available to us. So why not make the most use of it?
Exactly. Now, as you told, you mix up the multiple modalities. तो अगर मैं एक्यूप्रेशर की बात करूँ तो उसके साथ में कौन कौन सी मॉडलिटी को ज्वाइन करते हो, कनेक्ट करते हो to get the faster and the good result?
So for me, at the moment, I use majorly the biosoma therapy.
Okay.
Auricular acupuncture, scalp acupuncture, head and foot acupuncture, because all of these things together gives me brilliant results.
Okay. One question pop up, Pragattee, from the audience. Pratima ji has asked, how do you decide which modality will suit to the patient? आपको पता कैसे चलेगा कि ये मॉडलिटी ही पेशेंट को चूज करेगी, मतलब सूट करेगी? कुछ आपने उस पे
treatment which I usually prefer is one is the diagnosis.
Okay.
First step for any
Okay.
treatment is diagnosis should be apt. So diagnosis, not
Okay.
only I don't diagnose only through acupuncture, I would also diagnose through graphology and through other modalities also because medical graphology मैंने थोड़ा बहुत पढ़ा है. So उससे
Okay.
diagnosis एक बार clear हो जाता है. फिर जाके मोड ऑफ ट्रीटमेंट चूज करना बहुत आसान रहता है एंड ऑल्सो द मोड ऑफ ट्रीटमेंट गोज मोर अपॉन द पेशेंट ऑल्सो समटाइम्स बिकॉज समटाइम्स वी हैव टू कंसिडर द एज their bearing capacity. If somebody who is very old, say 95 years old, तो उनको मैं needle डालूंगी, so they will not be so accepting to it. So कौन से एज में क्या पेशेंट आ रहा है कौन सा समटाइम्स आई जस्ट हैव टू चूज कलर्स इफ द चिल्ड्रन आर कमिंग से 4-5 years के एज के so in that case I choose only colors because they will not be very accepting to needles in the first session. So depending on the
Okay.
patient you then choose which modality that you have to choose.
Okay. That's a very good in-depth answer, Pragati. Another question, it come about the duration. How long is the duration of one treatment? Suppose मैं अपने दांत के दर्द के लिए या बैक पेन के लिए आ रहा हूँ, just common question. So what is the average duration of the treatment?
It depends on how much the pain is there in the first go. Like the
Okay.
severity of the pain कितना है. अगर severity बहुत, it's like it's just in the initial stage, तो 4-5 session में it's good to go. But if the severity is there since more than 2 months, उसको दांत में दर्द है, तो उस हिसाब से modality of the treatment का procedure होगा. So it will take a little longer duration because जितना जल्दी आप डॉक्टर के पास जाओगे उतना जल्दी आप ठीक हो जाओगे. इट्स नॉट लाइक कि अगर आपको डायबिटीज एक दिन में तो नहीं आया, इट हैज कम थ्रू इयर्स. सो दैट्स व्हाई द मोड ऑफ
Yeah.
ट्रीटमेंट विल आल्सो टेक अ लिटिल लॉन्गर.
Okay. Okay. Now, actually, it takes some time. So I can consider around 1 week to 10 days on an average.
You cannot consider this on an average at all. The reason being that some patients get fine in the first session itself, and some patients take around
Okay.
10 sessions. So it depends
Okay.
on multiple factors about what needs to be done.
Okay. Okay. Another question pop up from the audience. That's Pragati, do you take the medical history also? Means while doing the treatment in
Yes.
alternative medicine, you also take the
Yes.
medical history of the doctor? Okay. Great.
Yes,
So,
that is something which is very, very important because
okay.
until we don't know the history, we don't know the food style, we don't know the lifestyle, it becomes very difficult to kind of formulate a treatment in itself. Because
Okay.
for a simple example, if somebody has joint pains and if I tell them that, आपको ये नहीं खाना है, and if that person has been eating that particular thing only since almost a month, तो वो मैं कितना भी एक्यूपंक्चर या कुछ भी करूँ उसको नहीं ठीक होने वाला है बिकॉज अल्टीमेटली तो आप वही चीज खा रहे हो.
Exactly, exactly. Now, as you told about the food and diet lifestyle, so how much is the roles of the diet or food is there into the acupressure? मतलब आपने बोला कि उस पर भी आप ध्यान देते हो.
Plays a major role because ultimately whatever that we are eating somehow has a reaction in my body. Like it's not like I'm eating once a day, it's like I'm eating 4 to 5 times a day. तो मैं जो खाती हूँ कहीं ना कहीं पे that is also plays a very important role to keep my overall gut healthy. Because like I mentioned that in acupuncture, stomach is the major area that we focus on. And if my gut is healthy, then my body will naturally be healthy. So if my gut is not healthy in any form, the first form of treatment will be to correct the gut, and then later on everything else is going to subside.
Okay. So somewhere it is against the Ayurvedic सिद्धांत that ये आपका स्टमक क्लीन और नीट होना चाहिए, इंटेस्टाइन क्लीन होना चाहिए, तो ही हेल्दी रह सकते हैं. To do the acupressure or the Chinese medicines, they do cover this the Ayurveda principles. मतलब उसमें Ayurvedic principles cover होते हैं क्योंकि foods are the thoughts we all know.
100%. Yes. It is based on the Panch Mahabhut that we have. Expression itself is based on the Panch Mahabhut that we have, and उसी के basis principle के ऊपर acupuncture is functioning.
Okay. हाँ, जितना मुझे पता है, like there's a little bit a variation into the five elements. Like in India, we have Agni, Prithvi, Vayu, Jal, and Akash. There, the two models, the wood and metal, has been added into the Chinese medicines or Chinese acupressure. तो वहाँ पे वो थोड़ा deviations आता है. तो they also work on the five elements. Okay. Now, as we talk about the foods, also we talk about how much the importance is the do and don't. Means अगर आपके पास मैं आता हूँ कोई ट्रीटमेंट के लिए, तो क्या कुछ डू एंड डोंट्स रहते हैं इसके लिए? जैसे फूड आपने बता दिया इम्पोर्टेंट है, कुछ और भी चीजें हैं डू एंड डोंट के लेके?
Food, water, sleep patterns.
Okay, sleep patterns also play
Food, water,
the
sleep
major role.
patterns, stress. These four are the major four pillars. If that we cannot ignore in any medicine, it can be in homeopathy, it can be in naturopathy, it can be in normal medicine. If these four pillars are not in place, irrespective whichever
Okay,
medicine that I give you, it can be a normal homeopathy
okay.
medicine, it can be an Ayurvedic medicine, it is not going to impact.
Hmm.
So
Okay.
sleep, stress,
So,
food, water, these four
hmm.
have to be balanced irrespective of everything.
Okay. Great, great. Now, as you told, now for the people who don't know the pricing, so I cannot say because every therapist has its own pricing for per session treatment. So, what are the, we can say, an average per session pricing of a beginner or even the expertise, wherein people can understand कि इतनी price तो रहती है acupressure treatment की
It
per day की.
pricing depends more on the expertise of the practitioner and which modalities they are considering. For a simple example, if I consider multiple modalities and if I will do the
Okay.
complete diagnosis, whereas somebody who's not doing the complete diagnosis, who's just focusing on say a part of acupuncture. So that's how the
Hmm.
pricing will differ. If somebody is just focusing on sujo, they would charge very minimal. But if for somebody who's like me, who's doing
Okay.
acupressure, acupuncture, sujo, color, scene, magnet,
Hmm.
every therapy in the session, the pricing is going to get a little higher because we are giving our time also. We are giving our time and energy also to treat that patient. So depending on multiple factors, the pricing is so it can start anywhere between 200 and go up to 5,000 per session.
ओके 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 तो इट इज गोइंग अप टू 5,000. क्या बात है, बहुत ज्यादा है.
Yes,
ठीक है ना, ज्यादा नहीं बोल
5,000
सकता लेकिन अगर
is
हेल्दी.
it's the kind of work also that they are putting in.
ओके तो जो व्हेन यू टॉल्ड अबाउट द प्राइजेज आर वेरिएंट, तो उसके अंदर क्या कपिंग थेरेपी भी डाल देते हैं एक्यूप्रेशर में, या उसका इंक्लूड रहता है, या वो अलग से ही कपिंग? गाइस, दोस हु डोंट नो, कपिंग थेरेपी इज अ प्लास्टिक कप इज बीन यूज्ड into the acupressure, wherein specially for the free flowing of the blood, जहाँ ब्लॉकेज होती है मेरिडियन पॉइंट के अंदर, वहां पे प्रिक करके वहां पर उस पर कप ऐसे वैक्यूम क्रिएट करके उससे किया जाता है, उसको कपिंग बोलते हैं. तो जस्ट अभी मुझे अचानक पॉपअप हुआ कि मैंने देखा था कुछ क्लिनिक के अंदर कपिंग थेरेपी का एडिशनल चार्ज लेते थे. इट इज
Understand?
स्टिल या? ओके ओके. सो व्हेन वी टॉक अबाउट दिस वन, तो एक्यूप्रेशर और एक्यूपंक्चर, क्या ये दोनों सेम ही है या दोनों में काफी अंतर है? देयर इज अ डिफरेंस बिटवीन दिस टू
दोनों
मॉडलिटी और इट इज द
दोनों
सेम?
दोनों के पॉइंट्स कहीं पे सिमिलर हो सकते हैं but the form of treatment is one that you are poking the needle inside your body. So the needle
ओके
stays for about 30 to 40 minutes. तो जब वो point 30 to 40 minutes तक press हो रहा है, the result is definitely going to be much more compared to pressure because pressure at one point is only for like say that I cannot give pressure, right? On one particular
राइट राइट
point, and
राइट.
while giving acupressure I have to focus on multiple points. So that is why I personally choose these needles because it's more better to treat the patient in 5 sessions rather than calling the same patient for like 20 sessions of for calling the patient for like 1 month, 2 months. So depending on your
ओके
time,
ओके
depending on how you would want to treat the patient, that's how you take it forward.
ओके ग्रेट. अब जैसा आपने बताया कि एक्यूप्रेशर, तो उसमें जो नीडल है क्या वो पिंच नहीं करती है? इफ यू यूजिंग द नीडल दो
It
डजंट
is
पिंच द?
it is 1/10 the size of the injection needle. So it is
ओके
it is very thin compared to the injection needle. So it obviously pricks. जितना चीटी जितना काटती है उतना पेन तो होगा ही, but it
ओके
is not much painful.
ओके ओके ओके. Now, actually, it's a very minor prick type variable
Yeah.
pain is there. So when any specific the patient who should take or who should not, I will say who should not take the acupressure acupuncture therapy, यानी कोई pro and cons है कि इनको हम दे नहीं सकते, like any ailments or any specification is given to the acupuncture.
Yes. So there comes a lot of specifications when it comes to treating patients who have cancer, who have patients who can just not heal themselves. Like varicose veins is something जिसमें acupuncture का कुछ भी रोल नहीं हो सकता है, because veins बॉडी के बाहर ऑलरेडी आ चुकी है. तो अभी मैं वेन्स को
Okay,
बाहर निकाल के उसको अंदर की तरफ मैं पुश नहीं कर सकती हूँ. सो डेफिनेटली इन
okay,
केसेस ऑफ से somebody has a fracture in the body, तो वो केस में आई कैन नॉट डू पर्सनली मच बिकॉज बोन ऑलरेडी टूट चुका है. तो अभी मैं बोन को वापस एक्यूपंक्चर से
okay,
मैं ज्वाइन नहीं कर सकती. So there are few
okay,
restrictions when it comes to acupressure, acupuncture. The best thing that we can
okay,
do is we can only reduce the pain, but I cannot join
okay,
something which has already been broken. For a simple example, अगर किसी को हाथ में बोन मिसअलाइनमेंट हो गया है in the body, so भी
okay,
मैं वो मिसअलाइनमेंट को मैं
okay.
ठीक नहीं कर सकती हूँ with acupressure. So these are
Okay,
few
limitations
restrictions
are
when
there.
it comes to acupuncture. And
Yeah, even from my side, there's a around mental health. That is the Krishna ji. Krishna is from the NLP areas. She has asked if you have the patient and the fracture recently, then it is okay for them to take the acupressure treatment. I think that's you given the answer. You cannot do anything. Better you give the answer. Pragattee, you are the expert in this field. ये क्वेश्चन का.
can you please repeat the question?
Yeah, the question of Krishna is if you have the patient fracture recently fracture हुआ है, bone fracture हुआ है, it is okay for them to give the acupressure treatment.
We can give the treatment is only to reduce the pain. जो पेन है वो
Okay,
कम डेफिनेटली हो सकता है विद एक्यूप्रेशर. बट अगर आप
okay,
बोलोगे कि वो फ्रैक्चर का बोन नेचुरली जुड़ जाएगा, सो दैट इज नॉट पॉसिबल विद एक्यूपंक्चर.
okay. तो इन अ वे कृष्णा शी इज सेइंग कि आप प्रेशर के द्वारा उस पेन को रिड्यूस कर सकते हो, लेकिन आप ये नहीं सोच सकते कि हड्डी टूट गई है तो बीच में अलाइनमेंट जो खराब है वो वापस जुड़ जाएगी. दैट्स अ वेरी वैलिड एंड वेरी लॉजिकल आंसर आल्सो. तो इट कैन हेल्प इन अ वे टू रिड्यूस द पेन. तो ट्रीटमेंट तो कर ही सकते हैं. Another question again come from Pratima ji. She is asking, do the needle prick the spot pain after the treatment also? यानी ट्रीटमेंट हो जाने के बाद भी वहाँ पे हल्का
नो,
हल्का सा पेन रहता है. Okay.
देयर इज नो
तो
पेन, बट
Pratima,
यस थोड़े लोगों को वो एरिया में रेडिश जरूर हो जाता है, बिकॉज सडनली मैंने बॉडी का ब्लड सर्कुलेशन बहुत एक्टिवेट किया है. अब तक वो एरिया में ब्लड
okay,
सर्कुलेशन नहीं हो रहा था. सडनली आई जस्ट ऐसे बोल सकते हैं मैंने स्विच को चालू किया है एंड ब्लड सर्कुलेशन को मैंने बहुत ज्यादा एक्टिवेट किया है. सो इन दैट केस डेफिनेटली देयर इज गोइंग टू बी माइनर साइड ऑफ पेन, बट नॉट पेन एट ऑल
okay,
once the treatment is done.
okay. So when we come about the pain management is a very big sector or a category into the Indian healthcare. तो इसमें ऐसे कौन कौन से पेन है प्रगति जो आप डील कर सकते हो या एक्यूप्रेशर या एक्यूपंक्चर डील करता है? पेन मतलब I hope you understand my question.
Every kind of pain, it can be headache. Every kind of pain, it can be headache, it can be neck ache, it can be cervical, shoulder pain, backache, hip pain, joint pain. Every kind of pain is something which acupuncture is specialized in, and it helps according to them.
Okay. Okay. One more question pop up from the audience. She's asking which is better when we compare the physiotherapy and acupressure. According to you, which one is better, physiotherapy or acupressure?
Both the therapies have its own pros and cons. Physiotherapy is a form of an exercise treatment which is going to help in cases of recovering. But along with that,
Okay.
acupuncture is something which is best for painful ailments. अगर आपको बॉडी में किधर भी पेन है एंड मूवमेंट नहीं हो रहा है, सो इन दैट केस ब्लड सर्कुलेशन को इररिस्पेक्टिव आपको एक्टिवेट करना ही पड़ेगा, तभी जाके वो एलिमेंट
Okay.
ठीक होने वाला है. So both the therapies in itself have its own pros and cons. We cannot compare these therapies in the first place because दोनों की speciality बहुत ज़्यादा अलग है. Acupuncture में हम blood circulation को forcefully activate कर रहे हैं, whereas in physiotherapy it's a form of exercise movement majorly, which is helping to recover. So physiotherapy is basically a movement therapy, and acupuncture is basically a forcefully blood circulation therapy.
एग्जैक्टली, वेरी वेल सेड प्रगति कि ये दोनों ही मॉडलिटी अलग हैं, ठीक है। अगर मैं एक और बात पे बात करना चाहूँगा कि जब हम एक्यूप्रेशर या एक्यूपंक्चर की मॉडलिटीज को अपनाते हैं या ट्रीटमेंट लेते हैं, कि उसके तुरंत बाद एक्सरसाइज, फिजिकल मूवमेंट्स, खाना, ये सब अलाउड होता है या फिर खाली पेट या उसके पहले खाना जरूरी होता है, या खाली पेट ही एक्यूप्रेशर या एक्यूपंक्चर की ट्रीटमेंट लेनी चाहिए? ऐसा कुछ विधान है, ऐसा कोई?
I would say that, yeah. For acupressure, I would say that a stomach a little empty is good. ऐसा नहीं होना चाहिए कि I've just have had a heavy lunch and उसके तुरंत बाद में acupuncture treatment कर रही हूँ. For a reason being that हमारे body का जो digestion process हो रहा है, वो जितना natural way में हो, वो ज़्यादा better है. Compared to something which because acupuncture में क्या हो रहा है कि आप needles डाल के body में blood circulation forcefully accept कर रहे हो. So definitely कि अगर acupuncture में अगर stomach is a little empty, it would definitely help a lot more.
Definitely. So
after the treatment, definitely you can eat everything and movement and everything is allowed.
Okay. आफ्टर ट्रीटमेंट चला, ऐसा कोई है नहीं कि आधे घंटे का गैप रखना है, उसके बाद खाना है, उसके बाद पीना, ऐसा कुछ भी नहीं?
Before definitely I would recommend a gap of half an hour, but after that you can do everything.
So when we talk about the pro and cons, तो एक और बात मैं पूछना चाहूँगा, what about the pregnant woman? Can a therapist or the modality into the acupressure who is working, he can give the acupressure to a pregnant lady?
I personally wouldn't recommend acupuncture at all to the pregnant ladies, because in the first place that हमारे acupuncture में ऐसे भी points है जो easy delivery में help करते हैं, and at the same time ऐसे भी points है जो miscarriage के लिए, easy abortion के लिए help करते हैं. So if a therapist by chance, if the therapist gives wrong points, it can actually lead to a lot of risk. So in that case, I would say that strictly no acupressure, no massage, no physiotherapy, nothing doing at all during your 9 months pregnancy period. Because why would you want to take a risk in the first place when it's not required? I mean,
exactly. True. I agree. So when we talk about the pregnancy part, so even in the post-pregnancy, how much duration one has to keep a gap to start with the acupressure or acupuncture therapy?
Post delivery, you can definitely start acupuncture as soon as possible if there is some kind of a major pain. But during a pregnancy, I would strictly avoid any kind of massage also, because massage may also what is happening that the points are getting pressed, and somehow irrespective, every person can make mistakes, right? We have to be very assured that everybody is a human and everybody can make mistakes. So in that case, I would not recommend at all.
Okay, great. When we talk about the pregnant lady, what about the elderly and the bachus, the kids? क्योंकि किड्स की तो चलो फिर भी इम्यून सिस्टम स्ट्रांग होती है, okay? So what about the elders and kids?
When the kids are born in the first place, we in India there's a tradition कि उनको at least 1 month तक concrete massage करवाना जरूरी है. So उससे क्या होता है, वो massage में क्या होता है, that is giving majorly acupressure and the points get activated throughout the body. So that is in itself acupressure ही हो रहा है. So that is something which is followed in India for sure. And to elderly people also, when you look at the tradition, people used to be like just pressing the feet used to make them a lot more happy. तो feet दबाने से actually होता क्या है, हमारे body का blood circulation ही activate हो रहा है and वही चीजें हो रही है. So हम लोग बच्चों से लेके elderly people तक हम सबको acupuncture in its pressure in some or the other form we are already doing it, but it's just like the names are very different.
Okay, okay. Now, as we talk about the blood circulation, so I will definitely come to the point of blood pressure, right? A high blood pressure and low blood pressure, जिसको मैं भूल गया medical term, hypo and hyper बोलते हैं, hypertension and hypotension. So in that areas also, जब मान लो किसी का हाई ब्लड प्रेशर है, तो क्या ऐसा तो नहीं कि मैंने उसकी मतलब किसी एक्यूप्रेशर थेरेपिस्ट ने उसको थेरेपी दे दी और ब्लड प्रेशर और शूट हो गया, ऐसा तो कुछ है नहीं, as you told, are dealing with the
Acupressure के लिए one
circulation.
thing is very clear that
Okay.
आपका पेन बॉडी में जैसा है वैसा ही रहेगा आफ्टर द ट्रीटमेंट, या तो फिर पेन सबसाइड हो जाएगा. In no condition, even if I press the wrong points, even if I do the wrong treatment, the pain can ever increase after the session.
Okay.
So
Okay.
even if the blood pressure is high or even if the blood pressure is low, it can only subside and it can bring your body in balance, but under no form
Okay.
it can kind of make the situation worse. So this is the major benefit of acupressure कि even if the therapy is not so experienced या knowledge नहीं भी है, फिर भी अगर वो ट्रीटमेंट करते हैं तो पेन एज इट इज रहेगा, बिगड़ेगा नहीं, irrespective of everything.
Okay. Great. Now let's talk about the mental health. Nowadays, the people are going more into the high level of anxiety, stress, and emotional trauma. So, how important the role of the acupressure or acupuncture is there when it comes for the mental illness, mental wellness?
So for mental health, acupuncture in itself. Can you hear me?
Yeah, I can hear you. You're audible.
Yeah. So in case of mental wellness, I would say that acupuncture in itself is not very sufficient to treat mental ailments. We have to combine different form of therapies such as psychology and visit a lot more counselor, and everybody has to be in place because acupuncture से क्या होता है कि points stimulate हो जाएंगे. But उसके बाद जो understanding है that acupuncture cannot do until the practitioner is a counselor as well. Because in that case is more like understanding how it works and everything that plays a very major role.
Okay. One question pop up again from Pratima ma'am. She's asking, will affect the blood pressure? I hope she's asking of the acupressure therapy or acupuncture therapy कि उससे के blood pressure पे
if I do treatment for blood pressure in acupuncture, definitely it affects the blood pressure. So there are specific points for blood pressure in acupuncture. अगर मैंने वो treatment किया तो definitely असर होगा.
अच्छा. Okay, great. Again, one question come because I have long back in undergraduation time. I have learned acupuncture. I was practicing also a few times also. As my study advances, I left this field. So I remember we used to give some electric current type. What we say, I don't know how to term that machine. Okay, so impulses, so radiations जाते थे when we insert the needles, and then we kept the wiring over there, jing janka, or फिर we used to pass on. So what is, can you help with the audience machines?
So that is majorly a TENS therapy. So what you're calling it as a current is majorly called as a TENS therapy. So TENS therapy में होता ये है that it's basically a acupuncture points in itself. So current से क्या होता है that body में blood circulation आसानी से होने के बहुत chances है. So it's basically not something very different. It's basically that I'm stimulating the blood circulation in the form of a current therapy.
Okay, great. Now, as we talk about these areas, मुझे एक और थोड़ी critical question है. That is about the surgery. Now, how effective is the acupressure or acupuncture into the surgery area or the post surgery? क्या सर्जरी अगर डॉक्टर ने बोला करना है तो उस टाइम पे हम उसको दे सकते हैं acupressure before the surgery, or if not, can in the post surgery we can go with the therapy of acupressure in the post surgery?
So in both the conditions, it depends on what problem you are looking to treat. For a simple example, if you are going for a knee ailment surgery, so before surgery also you can go for acupuncture. and after surgery also you can go for acupuncture, and it is more recommended also. But if you're going for a heart surgery, in that case, I wouldn't recommend to go for an acupuncture treatment before the surgery and post surgery at least for 2 weeks, because the body is in itself trying to recover. So in that case,
Okay.
it depends on which kind of a surgery you're going for and how you would want to take it forward.
Okay, okay. तो in the surgery, cardiac, this chronic ailments, acupressure में तो मनाही किया जाएगा, तो वहाँ avoid किया जाए और medical treatment डॉक्टर से लिया जाए, वो ज़्यादा fruitful रहेगा. Got it, got it.
True,
Very
true
well.
that.
Yeah, yeah. So, as we told now, how to know about when we are choosing acupressure therapist? So, is there any portal of the government wherein we can find a good acupressure therapist, or we can find a good acupuncturist? Okay, because अब कई लोग को पता ही नहीं होता, या फिर word
Depends
of
on
mouth हो
which.
जाते हैं. Yes, Pragattee.
So one thing that works for everything today is word of mouth. The second is just being very open to choosing your therapist well, because if you choose your therapist well, it definitely helps in a lot many zones, because the therapist is aware about how, what, pros and cons and everything. So in that case, I don't think that many acupuncturists you will find them on Google for sure, because
Okay.
website and all is still not very open to acupuncture. So maybe word of mouth is something which you can go best forward with it. कि किसके पास जाना चाहिए, something who has been tried and tested obviously, but at the
Okay.
same time have your own experiences. Just because it worked for them doesn't mean that it would work for you as well.
Okay. 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 अच्छा, one more question मुझे अभी अचानक से याद है. As we cover with the surgery, pregnancy, post surgery, cardiac, so what about the sports injury? If that someone has the sports injuries, क्या वहाँ पे acupressure की इस therapist को, puncture की therapist को apply किया जा सकता है into the sports injury if the sports person, some athletes come to you?
Yes, yes. So we
अच्छा,
have a completely
okay.
different modality who is functioning on. I know somebody who is specializing only in sports acupuncture. If
Okay.
somebody has a sports injury, तो उनको acupuncture से कैसे ठीक किया जाए, pressing few immunity points in itself during the sports ground also helps people perform better. So there is a complete different science and a complete different stuff which has been made only on sports right now.
Okay. So now I will touch. We all, yeah, yeah. Now we have already covered so many questions, but still a few questions come into my mind. Like in acute and chronic therapy, when we talk about the chronic, like paralysis is there, brain strokes are there. These are also chronic ailments. Epilepsies are there. Unconscious state.
पैरालिसिस if अगर किसी को होता है within 1 year, तो डेफिनेटली
Okay.
एक्यूपंक्चर ऑप्ट करना बहुत ज्यादा जरूरी हो जाता है, एटलीस्ट आफ्टर 1-2 months. द रीजन बीइंग दैट अगर वो फॉर्म ऑफ ट्रीटमेंट कर दिया गया है within 1 year, द चांसेस ऑफ रिकवरी
Hmm.
टुडे आर 90%, which is a lot. 90%
Okay.
रिकवरी
Great, great.
चांसेस
That's a
होते हैं if अगर ट्रीटमेंट किया गया within 1 year. 1 year के बाद
within.
the case becomes too late, the duration becomes too late,
Hmm.
and that after 1 year we cannot do much. But in cases of brain stroke and everything, also if the treatment is done immediately, say within 15 days, there
Hmm.
are high chances of recovery.
Okay, great, great. So all depends on the durations, how immediate the treatment one is given in this acute and chronic treatment. Okay, got it, got it. It was a very wonderful insight, Pragati, because I haven't touched those areas कि भाई कौन सा यहाँ पे क्या करना चाहिए. Now, can you give a few tips about the acupressure, common for the emergencies areas for the audience? A few tips
So
like emergency.
during emergency, I would say that in cases of if anybody has just fainted, you
Hmm.
don't know that it's a blood it's a heart attack, yeah, it's a stroke, yeah, it's a brain stroke, yeah, kuch bhi. In that case, all you have to do is just take any kind of substance which is there available with you, and just remove the blood from any of these knuckles. जब blood हुआ है. And in that case, if somebody has got a heart attack, if somebody has got a brain stroke, the chances of recovery are much higher till the time the patient reaches the hospital. The chances have to be there. So whatever come may through, just remove some kind of blood with needle, with anything that is available with you.
Okay. Okay. Another question come from the audience that once the treatment is done, after the treatment, what are the chances of the relapse of the pain? तो frequency बढ़ सकती है pain की
So
अगर
if you go for like a proper treatment, say every alternate day or every day, whatever the therapist has asked you to come. So after 15 days, your pain is going to be fine. But अगर आपने pain का साधन दिया, for simple example, I know that I'm allergic to corn and I shouldn't be eating corn. And again, if I eat corn, तो क्या होगा? मेरे allergy की symptoms वापस आने वाले हैं, irrespective of everything. So in that case, जितना आप उसको साधन नहीं दोगे, फॉर सिंपल एग्जांपल, अगर आपको बोला गया है कि आप रोज वॉकिंग करो तो आपका पेन ठीक हो जाएगा. बट इफ यू डोंट डू वॉकिंग एंड समथिंग, आपने साधन दे दिया पेन बढ़ाने का, तो डेफिनेटली पेन इज गोइंग टू इंक्रीज. सो इट्स नॉट लाइक एक्यूपंक्चर हैज फेल्ड. इट इज मोर लाइक कि अगर आपने उसको साधन नहीं दिया तो पेन नहीं आएगा. बट द डे दैट यू गिव इट अ कॉन्क्रीट रीजन, द पेन इज गोइंग टू रिलैक्स.
एग्जैक्टली आई डू अग्री क्योंकि लोगों को ये लगता है कि एक बार जाने के बाद तो फिर कभी जरूरत है नहीं. डॉक्टर की जरूरत कभी भी हो सकती है, उससे तरह एक्यूप्रेशर थेरेपिस्ट की भी जरूरत कभी भी हो सकती है. डिपेंड्स आप अपने फूड डाइट लाइफस्टाइल को कितने अच्छे से संभाल पाते हो. ठीक है, तो आई अग्री विथ योर स्टेटमेंट प्रगति. सो या आई थिंक वी हैव ऑलमोस्ट इन 1 hour we have covered all the major questions, all the FAQs which are generally asked for acupressure therapy. So thank you very much for covering all the questions and answering all those questions also. And thank you Pratima ji, Krishna and all the audience who has helped me to come up with a more and more questions. मेरे तो रहते, लेकिन आपके भी दृष्टिकोण से क्वेश्चन आप लोगों ने जो डाले हैं वो भी हम सबको, और जो ये रिकॉर्डिंग देखेंगे उनको भी डेफिनेटली हेल्प होगी ही होगी. ठीक है, तो आई थिंक वी हैव डन विद ऑल द मेजर FAQ. So thank you very much, Pragattee, for coming to my podcast, and it was very wonderful insight into the acupressure therapy. And I feel again a revision of my acupressure classes, okay, by connecting with you. So thank you very much, Pragattee, for giving your time and giving your valuable knowledge also to us. Okay. And somebody want to connect with the Pragattee, they can connect with Pragattee. And if you have some questions, you can put down it in the comments also, or you can directly connect to the Pragattee, and she will happy to answer. She's a very sweet girl, and she is from the humble background. So she ऐसा नहीं कि भाई पैसा होगा तो मैं जवाब दूंगा, ऐसा नहीं. She is a very from a nice background. So having the high level of empathy, I know her because she is very good girl. तो आप कनेक्ट कर सकते हो उससे भी, पर ये है प्लीज छोटी छोटी चीजों के लिए DM मत कीजिएगा. ठीक है, बिकॉज वो बहुत सारे मेजर क्वेश्चन है, उसका मैंने इसमें क्वेश्चन ले लिए हैं, तो वो आप पूरा रिकॉर्डिंग देख लीजिएगा बिफोर पिंगिंग टू प्रगति फॉर द स्मॉल क्वेश्चन. ओके, आई होप that is enough, Pragattee, from our sides. And yeah, I take a full stop for this session. Okay.
Yeah.
Thank you.
Thank you. It was
Thank you.
great interacting
Thank you,
with. Thank you.
Yeah. Thank you, Krishna. Thank you, Pratima ji. Bye bye. Take care.